today's consumer, age unrelated, but particularly the younger consumer who's spending more out of pocket for supplements than now the boomers are, right? They want a dashboard, right? They're showing up for wellness and supplementation the way they show up for a workout in the gym, right? They're getting on the treadmill and they want to see, like, how fast am I going? Is my rate improving? Am I beating my last numbers?
Welcome back to the Fitt Insider Podcast. I'm your host, Joe Veneri. Today I'm joined by Colin Watts, CEO of Thorne. In this episode, we discuss Thorne's evolution from supplements to science-backed wellness. Colin shares insights from his 30-year career in consumer healthcare, including roles at Johnson & Johnson, Vitamin Shoppe, and Walgreens. Plus, we explore Thorne's approach to quality and innovation as the company expands into health diagnostics and personalized nutrition. Let's get into it. Today's episode is brought to you by EGYM. EGYM provides fitness and health facilities with smart workout solutions built on its ecosystem of hardware, software, and partners. But it's more than cool tech. Their connected training experience delivers business results while helping members reach their wellness goals. If you run a gym, health club, YMCA, or any kind of fitness facility, you should check them out. Visit egym.com to learn more. Hi, Colin. Welcome to Fitt Insider. Thanks for joining us.
Thanks, Joe. Glad to be here.
Yeah, excited to chat. You have quite the experience across a number of companies, Vitamin Shoppe, Weight Watchers, Walgreens, and others. I'm sure I'm missing some, and obviously now at Thorne. But maybe can you just tell us about your background and what led you to Thorne?
Sure. Yeah. Look, I've been working in the consumer healthcare industry for almost 30 years. I started off at Johnson & Johnson and came up through their brand marketing area. Worked on a bunch of different over-the-counter drugs initially, like Tylenol and Motrin, a bunch of others. And then I was asked to start up the nutritionals division at J&J. And during that time, we acquired a couple of businesses like Viactive, which is a calcium chew business. We launched a brand here in the US called Benecol, which was a cholesterol-lowering statin business, a bunch of other areas. And actually, during that period of time, one of our biggest successes was Splenda. We launched Splenda worldwide, and it became a monster hit. J&J had asked me to take a hard look at other businesses potentially that we might acquire. And there was this little brand, this is now early 2000s, this little brand in the professional channel called Thorne that every time I did interviews with folks, did brainstorming, key opinion leader, et cetera, they kept bringing this brand up. And it was clearly something that was kind of a cut above the rest. At that time, Thorne was only in the professional channel. We're celebrating our 40th birthday this year. And for 35 years of our history, we've been only professionally focused. So back to my story, early aughts, took a hard look at Thorne, considered potentially even an acquisition, but the founder at that time was not particularly interested in selling. So I kept going through my journey in my career and ended up as the CEO of the Vitamin Shoppe for a period of time, which sort of gave me an even broader exposure on this industry. I'd spent a bit of time as the Chief Innovation Officer at Walgreens as well, which also gave me a unique perspective on retail, but also on innovation writ large against consumer healthcare issues. And then I did a startup for the last few years, thought I was maybe done. And I got a call from a private equity group that I'd known for a period who had just recently acquired Thorne and were interested to see if I was going to get interested in getting involved. And that evolved eventually into me being installed as the CEO here. It's an incredible business, Joe, and we'll get into this, unpack it a little bit. But I will tell you what attracted me to it was, this is a company that's got extraordinary professional heritage. It's gotten that professional heritage and that leadership because it's got one of the best quality profiles, if not the best, in the industry. It's got 350 SKUs. It's a massive product line and has continued to drive innovation year over year as you move forward. But what's interesting is we were publicly traded until the back end of last year when we were taken private. At that time, we reported we were about a $300 million brand. We've grown since. It's fair to say what's kind of extraordinary about Thorne is it's like the industry's best kept secret. If you walk down the street and you talk to 100 people, probably only about 10 of them would know Thorne. I was wearing the t-shirt last night playing tennis, and they asked me, like a couple of guys I was playing with, like, what is Thorne? And when you describe it and explain to them what the story of the business is, all of a sudden people light up. They're really interested in it. And yet our absolute growth is still, we've got a lot of upside. Let's put it that way. So exciting opportunity to join a terrific team to help to add some additional focus on innovation and brand and continue the journey, hopefully, for the company for many years to come.
Yeah, really a full circle moment for you, it sounds like, from that maybe initial introduction to it. And then really, yeah, I think what you're talking about is how I initially came to it, which was not so much through maybe like healthcare, the professional channels, but through sports.
Yeah.
The any sports team or sports medicine doctors, like a lot of folks, that's who they're going to. They're going to recommend you Thorne products, and has that kind of research, clinical backing, and then kind of seal of approval from all the right people. But in the consumer channels, right, like you said, still a lot of room to grow. As you think about, okay, if we were to characterize what is Thorne today, how do you do that? Because you said there's a lot of different things to unpack and certainly a lot of SKUs, but how do you think about like what the core of the business is now and maybe how you are looking to evolve that?
Yeah, great way to think about it. So I would say that our history has been as a science-driven clinical supplement brand. And we take our science very seriously. In fact, I was looking at our headcount recently. We've got twice as many people in our R&D group that we have in our marketing group. That gives you a sense for how much we focus on this. So we take that probably almost to a point of maniacal focus, quality and science driven. At our core, we sell pills and powders. At our core, we are supplement based. But we've found that we have permission from the market, both on the professional side. As you pointed out, when I use professional, it's not just the healthcare professional channel, but it is also the sports professional channel. There's no question that this brand has a lot of legs right now and is growing quickly on the professional side. But what we're finding is both from that channel as well as from consumers, they're looking for something from Thorne that goes beyond just pills and powders. They're looking for, a total wellness companion. There's a lot of questions, and your podcast focuses on this every single week, Joe. So I know you're deep in this space, but having been in this industry for a lot of years, there's always been a focus on wellness. Like it's sort of like fundamental that we're all trying to optimize. What has shifted more recently, and I'd say in the last 5 or 7 years that I've noticed, is it used to be that the wellness game was a prevention game. It was like, I'm going to take these pills because I want to get better before when I get old. And I want to optimize so that I can maintain my health for as long in my journey as possible. Now referred to often as healthy aging or health span focus. More recently, particularly because of the strength of the sports nutrition category, and I saw this when I was leading Vitamin Shop, because we had the same kind of split in our business, you're seeing people much younger getting into supplementation, but they're not thinking about it as just prevention. They're thinking about it as personal performance. It's like here and now. And personal performance doesn't just mean I want to get a good pump. Personal performance means I'm going into the office and I want good mental acuity, or I want good sleep. It's a lot of this lifestyle piece that they don't necessarily turn to their doc to get help with. Increasingly, they're looking for companies that are willing to bring high quality products, science driven, clinically demonstrated, that can make a difference in their lives. And I think when you ask me what's the core of what Thorne has to offer, I think we have the opportunity to graduate from just a pills and powders company to become a optimal personal performance company. And that's our aspiration. That means, yes, we do the pills and powders, but you're also seeing us get into health kits. You're also seeing us expand into a level of health coaching. And we have aspiration to continue to take this business to sort of wrap around the pills and powders the kind of ecosystem that we think our target consumer is looking for most.
I think those are a lot of, kind of trends or, you know, uh, even aspirationally ideals that people hold that a lot of brands are thinking about. They're triangulating, like, how do we figure out how to do this? One thing, obviously, that we've spoken to, Thorne has that trust and the reputation and the respect to be able to say, okay, we're already doing this core business exceptionally well. We've been doing it for 40 years, and that earns us the right to kind of go into these different areas. When you think about bringing that same level of rigor to maintain that trust, as you think about whether it's technology or diagnostics or, health companion, I would say there's a lot of people that want to be able to do that, but aren't able to bridge the gap while maintaining the kind of quality and focus and then entering new areas. How do you think about, evolving while maintaining that, not just the core business, but the core attributes, right? To be able to
Yeah.
bring that into new categories.
Yeah, there's a lot of questions there, but they're good questions. And they're kind of core innovation questions, right? They're kind of like any brand, any company should be grappling with this kind of issue. I think you have to start with understanding who buys your products, right? Like we are very clear. We just finished, since I joined, another fairly significant study, both of the consumer sector and of the professional sector, to look at the segments that are the highest prospect, but also the biggest users of Thorne. And since we've been growing at a rapid clip, very, very fast growth in the last 4 or 5 years in particular, understanding that consumer is super important. Understanding the value that they get from you today, particularly your core audience, is also super critical. There's a lot of companies, I've worked on brands that think they know what they give to the consumer, but actually they find out that the consumer is getting something very different, right? Is looking for something very different. And if you don't have your finger on the pulse of the needs base that you're serving, if you're not clear, buzzword of the concept of jobs to be done, if you're not clear about the job that your product or your brand primarily does for your target, you're going to tend to fail as you move forward. And then I think what we're trying to do here at Thorne, and I give my predecessor a lot of credit for this as well, is you're ultimately trying to create a big enough solution set that you're meaningful and differentiated to that target consumer, right? So you have to be sort of unique and relevant. Relevant meaning you have to fit into their everyday life. You have to be something that they're going to go to on a regular basis. You can't be sort of niche, but also you have to be unique enough that you don't sound like every other Tom, Dick, and Harry brand that's out there. What Thorne has is a unique DNA. We start with the science. We second that with the professional focus. We marry both of those with the quality of the product. And then what we look at is the consumer we're serving and the way we go about wrapping those attributes with the right types of solutions. And in our case, for 35 years, it was product only. And then we started to realize a few years ago, well, we also should get into this whole health kit area because our consumers want to know themselves better, and they're not getting the testing out of their relationships with their various MDs or others that they really want to have more control over. So why not give them the option to do a level of testing? We don't do obviously disease testing. We stay within the wellness sphere, but there's a lot of areas that we have, some of the best tests in the market that then unlocks a better understanding of not only our products to take, but other steps in the journey to get to that optimization moment.
The test kits is something I wanted to talk about because there are a number of companies that are doing it. Certainly that runs the spectrum from specific conditions to blood panels to wellness tests, all the way to, as you said, like disease diagnosis and things like that. But looking specifically at the wellness space, it's always been something that I've looked at and said, not only from like the connection between fitness and nutrition, the fact that most gyms, that basically the entire fitness industry doesn't talk about nutrition, doesn't talk about what's going on, meal planning, things like that. Same thing when it comes to a lot of supplement brands sell you every product, but is it working? Do I need it? Am I
Right.
deficient? Where does that fit in?
Right.
Is it working over time?
Right.
What does that look like now that you're offering them? And then what type of feedback are customers getting? And is that leading in a meaningful way to retention or increased purchases and all those sorts of things from like a business perspective to say, yeah, like this, not only is it benefiting the customer, like this is working in terms of business outcomes.
Yeah, I mean, this discussion about testing as a feedback loop is something I've been fascinated about for years. Pre-Thorne, even like Walgreens, we're looking at it pretty aggressively. Weight Watchers, it's a huge deal when you're dealing with weight management about how do you get feedback about your journey and how are you getting better on it. And Thorne has been, I would say, we're in the early innings still, even though we're a fairly substantial player in the health kits, test kit type of area. There are a lot of really good startups out there that are focusing on different aspects of at-home diagnostics testing to try to unlock better understanding. One of the biggest challenges I've seen, Joe, and you've interviewed and met with a bunch of these guys as well, one of the biggest challenges I think in that industry is the science is definitely there and it's getting better every day. The consumer sometimes can get an understanding from the results. Sometimes they have a hard time interpreting that understanding. But that type of diagnosis is only as good as the behavior change that occurs as a result. And what we think is that, we are uniquely positioned because we have a big brand, because we have a fair number of consumers that are already buying product from us, to be able to create an ecosystem, let's call it, that combines this diagnostic side, this understanding of where I am biologically, with product recommendation and other lifestyle recommendations. Just to be clear, we're not just using this to sell our product, but then the ability to come back for more, right? Like going back to this kind of shift that I've been seeing in the wellness industry in the last 10 years or so. It used to be that we would pop something and then just hope, right? Like pray that this particular product's going to work out, and 20 years from now, it's going to turn out that, I've staved off this issue, or have more energy, or I'm sleeping better, whatever. But a lot of these products were asymptomatic and we just didn't know, right? Today's consumer, age unrelated, but particularly the younger consumer who's spending more out of pocket for supplements than now the boomers are, right? They want a dashboard, right? They're showing up for wellness and supplementation the way they show up for a workout in the gym, right? They're getting on the treadmill and they want to see like, how fast am I going? Is my rate improving? Am I beating my last numbers? Boom, 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 as they move forward. They're playing this as a full contact sport. And the opportunity for us is to create an experience that meets that demand, so that we're not just relying on pop the pill and hope type of a situation. What is it doing for our business? Without getting into a lot of proprietary information, what I can say is we clearly see a fairly significant shift in LTV when someone comes in and uses one of our health tests and then proceeds into converting onto product, compared to somebody who just comes in straight onto product. Now, we see also significant LTV when somebody comes in through a professional, whether it's a trainer or it's a doc, who makes a recommendation and or some type of a sell for our products. We also see that increase over time. We like both, right? Like we strongly focus on letting docs be recommenders for us as much as we do for this kind of like a test kit approach.
I don't know if holy grail is the right word, but the idea of how do we take the diagnostics, the feedback loop, the data, put it in some type of dashboard, integrate all these other aspects of health, and show people how they're continuing to improve, what impact the products are having, not only your products, but other products. And to your point, other behavior changes, lifestyle modification, all those things. Looking across the number of solutions, platforms, where is this hey, we as Thorne have to go out and build this platform and incorporate it. We have to figure out the right partnerships. We have to have the proprietary technology to think about this dashboard and experience. Like those are a lot of pieces to put together. And I think it's a lot of things that other operators are struggling with to say like, hey, we want to play in this game too. But it's like, where do we buy, build, integrate, partner to say that like, okay, now what we have, we feel confident in to, have end users, using.
Yeah, I mean, you and I both know that's like a billion-dollar question. If we had the answer to that, we'd be making some really smart investments as we speak, right? It's been dogging the industry for a long period of time. One of the things I've always wondered about with wellness is there has not been a lot of standard setting brands in this market. Like if you look at other innovation markets, typically there's a period of time where there's a lot of cool innovation, but it's all very fragmented and things don't stick together. There's not an ease of use capability. I have to work pretty hard as a user to understand it. And then there's this moment where somebody breaks through with a standard. And when the standard breaks through, all of a sudden everybody harmonizes against the standard. There's a high degree of interconnectivity, and it makes life a heck of a lot easier for the user because now I'm not having to learn all these operating systems or learn all these other approaches. That's never occurred in supplements today, right? It's never really occurred in wellness. And part of it's because the industry has fought hard not to let it occur in some ways. This is an industry of a bunch of mavericks. We have companies like Thorne that like to do it our own way, like to do it our own approach. What I can say is this, on this specific conversation, which is not just about the pills and powders, but is more about this interconnectivity, I do think the data is leading the day. I do think also that increasingly we're going to have to see a level of harmonization in order to get a broad number of people on platform. And so as a result, from Thorne's standpoint, we are sort of agnostic about whether you get to Thorne through our own pipes or we're able to meet you where you are as a consumer. If you're choosing to use a Fitbit, or if you're choosing to use Apple Health, or if you're choosing to use an EMR, and those are your primary ways of like tracking your condition, tracking whatever it is that's helping you with your journey, we just want to be your partner that you can trust to help give you advice and ideally good product, if that makes sense, to help you on that journey. And so where in the past we might have had a little bit more of a closed platform, I think what you're going to see, Joe, as we move forward is much more of an open platform focus, because we think that for a brand that is this well known now and going to be increasingly well known, that serves us better as a company as a whole.
The Fitt Insider Podcast is brought to you by our friends at EGYM. This is an exciting partnership for us, and not just because EGYM makes some of the most innovative fitness products out there, but because the entire EGYM team, led by their CEO, Philip, is committed to making health, fitness, and well-being more accessible for everyone. And that's a mission we can get behind. By combining their smart equipment with integrated software and hundreds of connected partner brands, EGYM helps fitness facilities stand out by delivering a personalized, gamified workout experience that improves outcomes and member engagement. So if you're a gym or health club operator thinking about how to best serve your members while driving business results, go see what EGYM is up to at egym.com. Yeah, I think as you start to now, hey, how do we grow and reach and really realize the potential beyond that professional channel, and you think about getting to consumers, what is working, or what are you starting to put kind of like as the priorities to say, this is how we expand? If you think about that professional channel, doing the bulk of the work, or at least historically, now is it partnerships with influencers and athletes and endorsements? Is it social? Is it brick and mortar? Is it like, where do you see the kind of growth coming as you think about broadening those distribution channels?
Yeah, look, no one silver bullet for Thorne right now. It's a variety of different things that are lifting the ship more and more and more every year. Here's what was exciting for me as I came on board, right? I started in December of last year. In my first 2 months, besides, by the way, I should say the most exciting thing was I got a chance to work for a day in our plant. We make 95% of our products in-house. And I got a chance to actually get on the floor with our operators and clean some equipment and work on some product side and understand how it all comes together. It's unbelievable, right? I mean, I've worked in pharmaceuticals before. I've worked in food. I've worked in a lot of supplement areas. I can tell you that if you're buying our products, you can have a high degree of confidence that the quality that we're putting out there is like nothing else that you're going to see in the market. That being said, after I did that great experience, in the same week, I had two fairly significant experiences that kind of blew my mind. One was I got on the phone on a long call with the guy who is the head of all of the clinical side of integrative medicine for the Mayo Clinic. And by the way, I've had a bunch of KOL, key opinion leader conversations since I've gotten into this job on the medical side of the business. But I put Mayo up at the, close to the top of the heap. And we've had a over 12-year running relationship with them, primarily focused on medical education, patient education, but also in collaborative clinical studies. And, they have said to us, guys, you're the only one that we put at that level that we would want to operate at this close a level with, right? So we've done stuff as Thorne with Mayo that I've never seen anybody in this industry do before. At the end of that week, my sports team asked me to fly out to Las Vegas and meet with Dana White at UFC. And Dana White, you probably know Dana. Dana's a larger than life personality. I meet first with the trainers at their performance institute. We've had a 6-7 year relationship exclusively with UFC. They came to us because they had a doping issue. They had an adulteration issue, and they were having challenges keeping their athletes on supplements and clean. And they asked us if we would partner with them with product to be able to help their trainers and their athletes kind of clean up that mess and set them up for success. We started working with them, 7 years ago. Problem basically went away, has not been there anymore. And Dana basically said to us, you guys, we hold you in such high respect that you're the only supplement company we feel like we can trust to be a partner at this level with UFC. So for me, fitting that into 1 week, like Mayo and UFC, like talk about polar opposites in some ways. But at the same time, what they both got from Thorne was this focus on efficacy, on quality, on clean, things that we can serve particularly well. So when you ask me, like, how are you going to grow this business, Colin? Where do you think this is going to go? What I would say to you is, I think what we're learning about today's consumer is there's so much information available to them. There's so much choice available to them that they need some shortcut way to make the decisions that are right for them. Some of our target consumers will gravitate to healthcare professionals or places like Mayo, and they'll want to read clinical studies. They'll want to understand exactly how this product works, how it's formulated, what's in it to make sure that it's the right ingredients. And we can serve those folks really well. And we're going to continue to invest behind product innovation that makes sense for that space. But equally exciting is this whole area of sports performance area, and not just for our sports nutrition products, for things like therapy around concussive protection, for example, other things that Thorne products can help with that still are in the wellness arena, right, but are important to our target consumer. And we have an opportunity to create new products and to do more with their influencers to be able to drive an increasing number of folks to be aware of and ultimately to try Thorne.
To have that kind of sign off obviously gives you all the confidence in the world to continue to execute what is an ambitious strategy, because like the hard piece, you can't fake the trust and the efficacy and the research and the clinical studies and all those sorts of things. And that also hits on one of the things I wanted to ask, which was, it is a year in the job about and making this transition. You mentioned, hey, maybe I was done and thought like, more recently, and then being drawn to this role. How do you have the experience? It sounds like a couple instances you did, but being dropped into a company, especially in a transition period, being taken private, getting acclimated, you mentioned getting out there, cleaning the equipment, seeing how everything works, but just, hey, this is the way in which you operate. This is the type of leader you are. This is how you build relationships. What is that experience like? And how do you think about, your role as an executive and CEO?
So I got lucky enough, as I mentioned, to start with that I started in the healthcare arena and I trained under some incredible people. And I got a chance to be exposed to some amazing scientists, some amazing doctors. And I think healthcare is something that you really like, you get into your blood and you start to understand what is true health and what it takes to create breakthrough solutions that are going to make a difference in people's lives. There's also a little bit like at J&J, we used to talk a lot about the credo and about the importance of respect for patients and physicians and parents and all the other pieces that go through. And there are other executives that come from different industries that drop into healthcare that don't get a chance to get that dirt underneath their fingernails, if you will. I feel like I've had that since I was 25, and I'm old now, by the way. And I feel like that has been an important preparation for this job because it is essential at Thorne. Like if you don't have a respect and an understanding for that side of this brand and this company, you're going to miss the boat as you move forward. We've also been an innovation driven organization. We have internally, it's almost like we talk about ourselves as kind of maverick like. And I don't mean maverick like Tom Cruise like. I mean maverick like this is a band of folks from the very start when Al Zapp started the company 40 years ago who felt like we were going to teach the industry some things, right? That's the way the name came up, was a thorn in the side of the industry. And we have continually done that. As you look at shifts in our business model, shifts in terms of our availability, products that we've introduced, steps we've taken to push the envelope moving forward. So having been my chief innovation officer before, having spent my life kind of obsessed with innovation, that served me pretty well in this situation. What I'm appreciating more about Thorne is the pride and the people side of this company. It's not like a big corporation, right? I mean, it's got 800 or so employees. The vast majority of those are manufacturing focused, but it's also not a startup, right? It's big. It's, relatively big size company. What's impressive is in other companies, I've seen people create programs to create pride. In this company, you walk in the door and you sense it, right? It's there. So my biggest challenge is just don't screw it up, right? Like I have to walk the walk. I have to make sure that the choices that my senior team is making reinforces that pride. And ultimately, the big promise I've made to my team is I want to get the word out, right? Like, I don't want to be the best kept secret anymore. I want to be the standard bearer. I think we have the opportunity to sort of put the level in this industry at a whole different level moving forward. And I think the industry in a good way has been moving up anyway. But like we're one of the biggest companies to ever do NSF certification. And we have the broadest line right now that's NSF certified, right? Now Amazon is demanding that people get third-party tested against their products, and NSF is one of the places where people are getting that testing done. We're a notch above that, but I'm super glad to see that happen. I think it cleans up the act of the industry as you move forward. So I would say part of it, Joe, is to try to bring a humility to the job, right? Like I'm the third CEO of Thorne, and it's like I always think every brand that I've gotten a chance to be associated with, my job is to be a good steward of both the people that work on it and the brand itself, so that ideally it's going to be around for hundreds of years moving forward. I think Thorne's going to be $1 billion business. And I hope that Thorne's going to be one of those brands 50 years from now that we'll be talking about as like it really reset the table for supplements.
Maybe a couple more questions before we wrap up. And one just kind of builds on this. Obviously, you talked about your background and a number of experiences and from the healthcare, but also having the innovation and now thinking about growing the brand in the consumer space and in some sense, like continuing to be that steward. Like, how are you able to marry those things? It feels like, to be able to be in the kind of CEO role, but to still stay in it, the passion kind of comes through, I guess is what I'm getting at. Like, so passionate about, continuing to grow this company, but doing it in a way where you're obviously very close to not only what's happening from the consumer perspective, but also with the employees. It seems like, especially 40 plus years a company goes on and continuing to maintain that bar, I guess what is it that motivates you or inspires you? Or how do you kind of bring that energy and focus in a way that's like, you're not sitting in that chief executive role and things are happening, but you're maybe not as in touch with them as you certainly seem to be?
Over the course of my career, as I've gotten older and gotten more experience, there's been a clear choice about whether it's moving into bigger and bigger corporate jobs or getting closer and closer to the market. I'm not a startup CEO, right? Like I admire to the ends of the earth some of the startup CEOs that are out there, and I've gotten a chance to work with a bunch of them as an advisor or an investor at times, et cetera. I'm a growth CEO, right? And frankly, I don't throw the title around too often. I'm a growth executive. I believe that you've got to be ready to do the highest job and the lowest job in the company. And I have always been taught by the folks I admired most in my career that like being willing to roll up your sleeves and sit down and get into the weeds on stuff is part of the job. And you can say, is that a good use of my time, to spend a day in the plant, cleaning equipment and sort of talking with the guys that are on the front line for the business? Or, when I was at Vitamin Shop, going out and working in retail and working the stores and getting to know it. But one, I think when you get that exposure, you learn a lot. Two, symbolically, it means a ton to the company, right? They all of a sudden, not because of me, but it tells them that management is like right down there in the front lines with them as you move forward. And then the last is like I got into marketing early. I could have probably done a bunch of other stuff. I just think consumers are fascinating. I think wellness is fascinating. And the thing that I love about wellness is for a lot of years, healthcare was locked away from the common man. And it was like this sort of thing done by these, titans that had all the information. And over our generation, last probably 30 years, it's now shifted more and more into the hands of the consumer. That's terrifying in some cases
Yeah.
because we're not ready for that responsibility. And we need folks that are experts. We need healthcare professionals to be successful. But at the same time, we're democratizing it. And I think more and more people are taking it seriously. I find that fascinating, right? And so, yeah, I bring a lot of passion to the job just because every time we look at these things, I think there's another Rubik's Cube to go fix. And I find that to be a fun part of like getting up in the morning.
We'll wrap up with this, whether it's something you're excited about that's coming up that we should keep an eye out for, or is there anything that, we should check out or anything we should be mindful of kind of coming up here soon?
I mean, look, I always encourage people to go check out our website, thorne.com. It's Thorne with an E on the end. It's one of the better design sites that I've seen in the industry, and it carries a huge amount of content information. So even if you're not necessarily looking for a product from us, you'll find a lot of very, very valuable information moving forward. I would say, and I know this is like an industry trope that's out there right now, but I think in the same spirit of democratization that we just talked about, I'm excited about what's going to happen in the wellness space around AI. And I do believe that when we think about this need to make complicated information, science information available on the terms that a average consumer wants to consume it, it's been very challenging to do that cost effectively historically. We at Thorne are looking very hard at technology solutions, and I'm sure that there's lots of others that are doing the same. But we do think that you're going to start to see some companions, some capabilities in the market in the not too distant future that could make a huge difference in unlocking a better understanding about what the products like we sell can make in people's lives. I guess the only other plug I'll make, last week, Joe, if we had this call, I was coming down with COVID for the second time, got pretty darn sick. One of our docs in-house turned me onto our quercetin complex. Coming off of COVID, I can't believe what a difference it's made for me. So if you want to check out a very impressive product that I had not known about beforehand, it's quercetin's a very impressive product. So for what it's worth.
Yeah, that's glad you made a speedy recovery. We will maybe a part two on AI and wellness because I feel like we could go at least an hour on that, and as that continues to play out. But we will get the website linked up in the show notes. Encourage people to check that out, and really excited to share this conversation. So thanks so much for joining us.
Thanks very much.
Thanks for listening to today's episode. If you got value from the conversation, please consider subscribing and sharing the podcast with a friend or colleague. It's a massive help. And if you want more content like this, including news and insights on the latest industry developments, subscribe to the Fitt Insider newsletter at insider.fit.co. And one more thing, you can learn more about our recruiting and consulting services at fit.co. That's FITT.co. I'll see you here next week.